Good afternoon. This is Congressman Mike Levin, and I'm very grateful to everyone for tuning in to this town hall on the coronavirus. This is obviously a very tough time for our community, and we hope that in the next 90 minutes you're going to get a lot of information that will provide useful. We are joined by a fantastic expert from UC San Diego, Dr. Richard Garfield, who I'll introduce in just a minute. But before I do that, I want to thank our whole team. Both my wonderful official staff who've been working just incredibly hard, as well as my campaign team. This is a really unique time in our history, a difficult time, and just know that we are here to help in any way that we can. And for all those in our community who've been impacted by this virus, particularly our friend Steve Padilla, who's on the Chula Vista City Council, who I know is at the hospital right now, just know we're with you, we're thinking of you, we're praying for you. And let's just all come together as a community as best we can to try to show the best of what makes us Americans and the best of what we've got here in San Diego and in Orange County in these coming weeks and months. With that, I wanted to introduce our local expert today, Dr. Richard Garfield. Dr. Garfield is an infectious disease epidemiologist, educator, and healthcare innovator who seeks to understand the causes of disease and translate that understanding into impactful solutions. Dr. Garfield earned his PhD at Johns Hopkins University and MPH at San Diego State University. He served as an Epidemic Intelligence Service Officer and epidemiologist for 7 years at the Centers for Disease Control and Prevention before joining the UC San Diego School of Medicine in 2005. Dr. Garfield's research focuses primarily on airborne and bloodborne infections often associated with health disparities and substance use, including tuberculosis, HIV, and viral hepatitis in the U.S. and abroad. His research on digital adherence technology over the last decade informed CDC and WHO guidelines on the use of telehealth for remotely monitoring patients with tuberculosis. Such technology has relevance today for COVID-19 monitoring and patient support. Dr. Garfield, thanks so much for joining us today. Again, over the next 90 minutes, we're going to share the latest public health and safety information, as well as let you know about what we're trying to do in Congress, and we're going to take your questions along the way. To ask a question, you can ask it right in the live stream there on Facebook, if you're watching us on Facebook, or you can email us at townhallquestions@mikelevin.org. That email address, again, townhallquestions@mikelevin.org. We'll try to get through as many of the questions as we can. Well, a lot of this information is scary, and many families are feeling anxious right now. It's important that everyone remain calm and take reasonable precautions. We're going to get through this crisis together. And with that, I'd like to turn it over to Dr. Garfield. Thank you again for being here today. And you want to share some basic information from CDC and other sources.
It's my pleasure. I'm happy to be here, and I know a lot of people are nervous, and I think it's important to have scientists be at the table to help to get information out there that's accurate so that people can make good decisions. So the number one thing that we can do to keep each other safe and healthy is to follow guidance from the Centers for Disease Control and Prevention, the California Governor's Office, and the public health agencies in San Diego and in Orange County. At this point, you probably heard the term social distancing, but you might wonder what that means. Well, first, the CDC has recommended that everybody put distance between yourself and other people. This is especially important for people who are at higher risk for getting very sick, including the elderly and people with chronic conditions such as diabetes, lung disease, any sort of autoimmune disease that lowers their immune system. Regardless of your health or age, you should also stay at home as much as possible to further reduce the risk of being exposed or exposing to others. This means eliminating any kind of unnecessary travel to avoid putting yourself in places where there are many other people. If you do have to go out, keep at least 6 feet between you and other people to avoid contact, and wash your hands often. This is really critically important. You should also avoid any kinds of crowds as much as possible. The administration and our state and local governments has recommended against any non-essential gatherings of any size. If you need food, consider ways to get it brought to your home and to your family, to avoid social interactions and commercial networks. The CDC has also shared guidance on other steps that you can take to prepare yourself and protect yourself. So you should contact your healthcare provider and ask about obtaining extra medications so that you don't run out, and you can make sure that you're staying healthy with other health conditions that you might have. Be sure that you have over-the-counter medicines in case you do start to have symptoms, either from coronavirus or from anything else. These kind of medications would be for things like treating fever or other symptoms like sore throat and cough. You should have enough household items and groceries that will allow you to stay at home for a period of time. There are other everyday precautions that the CDC recommends. First and foremost, wash your hands often with soap and water for at least 20 seconds. Make sure you keep the soap on your hands long enough to actually do some good. Don't just do a quick wet and wipe. Let the soap take action. And then do this anytime you blow your nose, you cough in your hands, or you sneeze, because every time you do that, they become recontaminated. Or if you're touching surfaces that might have been touched by other people who are sick. If soap and water is not available, you could use hand sanitizers that contain at least 60% alcohol. To the extent possible, also avoid touching surfaces that are touched by a lot of other people. That would be things like elevator buttons, door handles, shaking hands with other people, handrails. Avoid touching your face and your eyes, and this is critically important. The virus doesn't get through your skin on your hands, so if you do touch something, don't panic. That's okay. Just don't put your fingers in your eyes, mouth, or nose, because that's how the virus gets into your body. So if your hands get contaminated, that's okay. Just make sure that you wash them or use hand sanitizer as soon as you can afterwards, before you touch your face. Clean and disinfect your home to remove germs. So the virus is known to survive on countertops and handrails for even a day or two, and so it's important that we make sure that we keep cleaning those surfaces to kill the virus. The CDC has also suggested that you have a plan for if you do get sick. First, stay at home. Call your doctor before you go to their office. Don't drive to the office to tell them you're sick. Call them first, let them know, give them a heads up. They can walk you through whether or not the symptoms that you have might be suggestive of coronavirus or something else. If you're not sick enough to be hospitalized, you can recover at home. As much as possible, you should stay in a specific room away from other people at home. You can transmit to other people in your family. In fact, that was one of the major reasons why China has implemented such severe measures to try to prevent transmission, is because they found out that this is not something being transmitted through hospitals. It's actually being transmitted mostly from people in their homes. And so if somebody's sick, make sure that you keep some distance. Also, make sure you use separate bathrooms and disinfect the house frequently. I also want to share some information on testing. I know this is really important to people. If you are a close contact of someone with COVID-19, or you're a resident in a community where there's an ongoing spread of COVID-19 and develop symptoms, call your healthcare provider and tell them about your symptoms and your exposure. They will decide whether or not you should be tested, but keep in mind that there's currently no treatment for COVID, and people who are mildly ill may be able to be isolated at home and just recover on their own. People at higher risk for serious illness for COVID-19 should contact their healthcare provider early, even if the illness is mild. If you develop emergency warning signs such as shortness of breath for COVID-19, get medical attention immediately. Also consult your medical provider if for any symptoms that are severe or concerning. And I'll turn this back over to Mike.
Thank you, Dr. Garfield. Appreciate that very much. I wanted to turn now to some of the things that we're doing in Congress to deal with COVID-19. Earlier this month, we passed an emergency coronavirus supplemental funding bill of $8.3 billion in entirely new funds, which was critical to the early public health response. Of course, not nearly enough. We know that this is going to be an issue that we're going to have to deal with for many months, and perhaps some of the estimates say 12 to 18 months, but nonetheless, that early bipartisan bill, I think, set a good foundation. Of course, we have to make up for lost time, particularly with regard to testing, and that's what our second bill was designed to do, a roughly $100 billion bill, the Families First Coronavirus Response Act, that was just signed into law, and it has several elements. First, it provides for free testing. The bill ensures that all individuals who need a test, including those with any kind of insurance, as well as the uninsured, will pay no cost for COVID-19 tests. Now, of course, we've got to work very hard to make sure those tests are actually available, at scale so that if you believe you need a test that you can get one easily. The bill also expanded paid sick leave to as many as 87 million U.S. workers, according to an analysis by the House Education and Labor Committee. Many of the people who are eligible currently have no paid leave and are being forced to choose between their paycheck, their health, and the health of the people around them. That's clearly unacceptable, and the bill that we passed is a critical first step towards protecting families' financial security and mitigating the spread of the coronavirus. A vast majority of these workers are set to receive full pay for 2 weeks of missed work that's related to the coronavirus. Now, of course, we all know that is not nearly enough, that we're going to have to deal with this issue for a lot longer than 2 weeks, and we're working on it right now, as a matter of fact. The bill that we passed that was signed into law includes more than $1 billion to provide food for those who need it most, including low-income pregnant women, mothers with young children, and low-income seniors. It ensures that students who depend on schools and childcare for free and reduced price meals continue to have access to nutritious foods during closures, and it provides women, infants, and children with the flexibility to access food and infant formula without having to make unnecessary or unsafe visits to clinics. This was short-term policy, it was important policy, and it's going to provide immediate relief to families facing coronavirus. The other thing I wanted to mention is just this past week I was able to work with my colleagues in the House and the Senate to pass a bill that would allow for GI Bill benefits for veterans to be used for distance learning, for remote learning. So critically important because that actually required congressional action, and we were able to get it done unanimously, which meant that none of us had to go back to Washington, D.C. So we were very proud of that as well. But make no mistake, as this crisis develops, the House needs to take strong, strategic, and science-based action to keep the American people safe. And we're really dealing with two crises at the same time. One is the public health crisis. The other is the economic crisis. Of course, if we can deal with the public health crisis, that is the single best way that we can deal with that economic crisis. So it's so critically important that everybody take this seriously. Follow those guidelines that Dr. Garfield just mentioned. Let's do all we can collectively to try to flatten that curve. And at the same time, we in Congress need to do everything that we can to try to provide the financial resources to families and to companies to ensure that people can continue to get paid and that the economic impacts of this are as minimal as possible. There are going to be huge impacts, we know that, but we want to try to mitigate them to whatever extent possible. One step I wanted to make sure that we got out there, if you're a business owner, the Small Business Administration has signed a disaster declaration with the state of California, so you can apply for federal aid by visiting the SBA's website. Specifically, the web address is disasterloan.sba.gov/ELA. That website again is disasterloan.sba.gov/ELA. And we know from what we've seen that the administration, working with Senator McConnell, Majority Leader McConnell, they're proposing a $1 trillion package right now. We're looking at that package very closely. It's critically important for me that any such stimulus package first values workers more than it values corporate CEOs. So there are a few major things that I believe in. I put out 5 basic priorities. First, corporations receiving aid should be completely prohibited from using taxpayer dollars for stock buybacks or executive bonuses. I was encouraged to see the President this morning talk about the need for no buybacks with any of these funds. Second, corporations receiving aid should prioritize keeping their workers employed with the same or better benefits than they enjoyed before the COVID-19 outbreak. Third, corporations receiving aid must abide by any and all environmental, labor, and tax laws. Fourth, Congress needs to establish an independent authority to oversee the assistance program with significant penalties for bad actors. And fifth, we can't forget about nonprofit organizations. We've got so many nonprofits that are hit here in our community, in our district, aid organizations, museums, cultural establishments. We can't leave them out. With that, I'm going to turn it back over to Dr. Garfield, who has some additional comments about the medical aspects, the technical aspects of COVID-19, after which we'll get right to your questions. Dr. Garfield.
All right. Thank you. Well, I just wanted to interject a little bit of science here for anybody that might be interested and curious about what this is all about. The coronavirus is a virus that normally we think of as just causing the common cold. It's probably originated in bats and passed over to the human population about 800 years ago and has become a fairly mild disease. Interestingly, this disease, although it affects the whole population, it's typically only infants and very old and frail people who actually would succumb to the disease. But coronavirus is different. Coronavirus is the highly pathogenic strains of coronavirus, which includes SARS, which had a pandemic in 2002 to 2003, and then more recently MERS, the Middle Eastern Respiratory Syndrome disease, which started in 2012, and now we have COVID-19, which started in December of this year. These are the highly pathogenic coronaviruses. They were recently introduced to the human species. We don't have any protection against it. It's new, and so everybody in the planet is susceptible. And that's why it's so important that we really, really do make an effort to try to prevent the spread of it and slow it down, because we're all susceptible. Potentially every one of us could get it once we are exposed. And if that all happens at once, we'll overwhelm the healthcare system. Those of us that get really sick are going to be in dire straits because there's not going to be a place for us to get the care that we need to be able to survive this. So by following the CDC's guidelines and practicing social distancing, washing our hands carefully, being careful about transmitting the disease, going to the doctor when necessary, getting tested. These are all things that we can do to help to slow down the spread of the disease so that, for God forbid, those people that do actually need the more intensive medical care will have the healthcare providers and the bed space available to them when they need it. So we all have to do our part here to make sure that we can control this pandemic.
Thank you, Dr. Garfield. And again, I'd like to remind our audience that if they have questions, they can ask in the live stream in the comments section, or even better is if you email us at townhallquestions@mikelevin.org. Again, townhallquestions@mikelevin.org. We'll get your questions, and we're intending to do one of these every week. So if we don't get your questions this week, we'll get to them next week, or we can always respond to as many of them as we can as well. So thank you for a bunch of the questions that have already come in, and I'm going to start with Patty in San Clemente, and Doctor, we can kind of go back and forth on answering these. Patty in San Clemente asks, what is the criteria or qualification for the upcoming financial relief direct payments to all adults? My questions relate to people who are not employed. For example, number one, will people whose only income is government disability be eligible? Number two, will seniors on Social Security and or pensions be eligible? Patty, excellent questions. A lot of that is being worked out as we speak with this big stimulus package, and I am absolutely convinced that we're going to get this done for the good of the American people, but we don't want just any bill to pass. We want a great bill that's going to put workers first and going to put regular old people first, and that's what we're going to fight to do, and I'm going to do all I can to make sure that we help people that are in your situation. A couple of things that I'll mention. One is that my friend Joe Kennedy, representative from Massachusetts, he has a bill that would guarantee $4,000 in annual direct cash payments to adults earning less than $100,000 each year, as well as $2,000 per child for families within the same income bracket. Those earning above $100,000 would receive $2,000 and $1,000 for each child. In addition, for those earning below $100,000, payments would continue after the first year as quarterly installments until the unemployment rate falls below 5.5% for 2 consecutive quarters. I am personally a big believer that we need to not just have a one-time or two-time check that we pay to people, but we need to tie it to some measure of the performance of our economy, whether it be GDP, whether it be the unemployment rate. It's going to be, I think, very important that we look at this for the long haul and that we do all we can to ensure that we put in place policies that are actually going to benefit regular folks until this crisis comes to an end and people are actually back at work and the economy is back working again. Senate Republicans, on the other hand, they just announced their plan, and it's very different. It says individuals would receive up to $1,200, married couples up to $2,400, and $500 per child. However, if you earn more than $75,000 annually, payments would be reduced by $5 for every $100 earned over the $75,000 threshold, meaning those who make more than $99,000 wouldn't receive any payment at all. So I do think that I'm encouraged by, in one sense, the fact that they're looking at direct cash payments. I think that's valid given this unprecedented crisis. However, I have significant disagreement with how that would be implemented and particularly whether those standards are the right ones that should be used. So I'm going to advocate also for something that's not just once or twice, but something that actually is in effect until the economy turns back around, because we don't know how long it's going to take. Here's another question from Angela in Rancho Santa Fe, and there are also several other constituents that are asking similar questions. What about realtors, mortgage brokers, and other 1099 contractors? As 1099 contractors, we get nothing. No sick leave, no vacation, no health care, no unemployment, no disability. You're absolutely right, and it's so critically important that in this third bill, in this stimulus bill that we're working on right now, that the needs of independent contractors are loud and clear and that they're part of this solution. So I'm absolutely mindful of that, and we're going to advocate for that. I wanted to just again remind everybody that the bill that we already passed, the second bill, the Families First bill, includes up to 87 million workers and strengthens unemployment benefits to laid off and furloughed workers, as well as those workers who exhaust their allotted paid leave. And so we absolutely have to work with the administration and Senate Republicans and do what's best for the American people, but we cannot compromise our values that it's got to be for the regular working people in this country and not just for big corporations or for CEOs or for executives. Next is a question for Dr. Garfield, and the question is as follows. What is San Diego County doing about building pop-up hospitals and other places to get tested? And that's from Francine in Encinitas.
Francine, thank you for that question. I think it's a really important one. I will start by saying that we're very fortunate in San Diego and Orange County to have some of the best hospitals in the country. With UCSD, UC Irvine, we've got the Naval Medical Center, several different healthcare systems, which do have capacity right now. What I'm concerned about are some of the other parts of the country where they really don't have a hospital system that can support extra patients. And so it's good that we're thinking about this now, because if the epidemic really spreads rapidly, we have more patients, we are going to need that extra capacity here in San Diego. One thing that is happening is there are two ships, one going to the East Coast, and fortunately for us, one coming to the West Coast. It's most likely going to Los Angeles, the Mercy, which will increase the number of hospital beds in the area by about 1,000, I believe. Critically important here, though, besides the number of hospital beds, is the number of ventilators. COVID-19 affects the lungs. It causes a severe pneumonia, and for many people with critical illness, if they don't have a ventilator, their chances of survival are very low. So the number of beds is important, but having those ventilators available in those hospital rooms is really important, and there's just not enough of them. So companies are working hard now to produce them. I've heard that we're actually looking to China to find out if we can use some of the ventilators that they're no longer using because their epidemic is starting to wane. And I think that we're trying to manage that capacity as best we can. But again, what we can all do to really prevent that from being a problem is social distancing, hand washing, careful precautions, listening to the CDC and our health experts.
Thank you for that, Dr. Garfield. Next question is from a veteran, Joe in Oceanside. I'm a service-connected disabled veteran, and I get treated at the Oceanside VA. I've had a cough for roughly a week, but I don't have a fever, and I'm not short of breath. But I do have the cough, and I'm in the high-risk category. I was told by the doctor that the VA does not test people for my category. Is the VA prepared for this pandemic? Well, that's a great question. I have done a couple things. First of all, I think locally, I've spoken a couple times with Dr. Smith, who runs the La Jolla VA hospital and the overall San Diego VA, and I think we are prepared locally. You may have read that the first 3 positive cases of COVID-19 at the San Diego VA were just found this past week. And I went through with Dr. Smith the various scenarios that the San Diego VA has in place, the logistics and other issues, whether they have sufficient equipment, et cetera, et cetera. What I can say is that I think the testing criteria is still limited by the fact that we don't have enough tests available, and that's why that testing criteria is so rigorous. So I do think what you'll see is more and more when we have the tests more readily available. A lot of our local companies like Thermo Fisher and others are working very hard. Quest Labs is working very hard to try to get as many of those tests out there as quickly as they can. Then I think you'll see where if you have only one symptom that you'll be able to be tested. Now it's very tough to get tested. You have to get a recommendation from a doctor, and basically you have to have all of the symptoms in order to be tested. And sometimes even then you don't get your test results back for many days. This was, unfortunately a huge a series of missteps early in the process from a variety of federal agencies. And again, not to point fingers, because we've got to move forward and we've got to fix these things moving forward, but that's why we are where we are. I've also written VA Secretary Wilkie asking for daily updates from VA on exactly how many COVID-19 patients they have, on all the different supplies that they have. And obviously, we want to make sure that we're taking care of our veterans. It's absolutely at my top of my mind, and serving on the House Veterans Affairs Committee and chairing a subcommittee that has jurisdiction over things like the GI Bill. That's what I've been focused on in part this week. And as I mentioned at the outset, we actually passed a bipartisan bill, emergency legislation, unanimously to make sure that GI Bill benefits are also available to those programs that are distance learning, because literally it seemed like overnight all the colleges and other vocational programs that our veterans were taking advantage of through the GI Bill, many of them went to distance learning. So I was really proud that we were able to get that done. But we're going to stay on top of it. We're going to make sure that the VA, and specifically our local VA, have all the resources that they need, because we want to make sure we take care of our veterans. With that, I'm going to turn it to another question for you, Dr. Garfield, from Kathleen in Vista. She asks, what if we spray or wipe Lysol on our gloves before going to the grocery store? How long would it last? Would it kill the virus on a surface for the next person? Slow down the spread? Would it prevent contracting the virus if we touch our face?
Well, that's a very good question, Kathleen. And it's interesting because a lot of people are wondering how's the best way to prevent spread. And I like the idea that you're thinking about other people by spraying your gloves. If you touch something, or you're actually maybe killing some of the virus and preventing somebody else from picking it up. Unfortunately, I think that it's not the best approach to wear gloves. And the reason is that when you wear gloves, you tend to feel protected, and you might not be as cautious about washing your hands. The gloves get contaminated, and anything that you touch with a contaminated glove is going to get contaminated as well. And so even though you might spray some Lysol on those gloves, that eventually will dry up and not be effective, and then you're just continuing to spread the virus. If you have bare hands, you're going to be more conscious of the fact that your hands are dirty, and you'll be careful not to touch your face or touch your face, and you'll be more likely to wash them more often or use hand sanitizer. So currently the CDC does not recommend wearing gloves for the general public. It's unnecessary, and in fact it could actually be harmful. So it would be better to just be careful what you touch, and when you do touch things, wash your hands.
I'm going to throw another question your way that you don't know is coming, which is we get all kinds of stuff. We've been fortunate in that some of the deliveries now have started again from Amazon and from some of the other companies, and they have boxes. Obviously, they're delivering to us and to everyone. What can you tell me about making sure that those boxes are safe? Should we be wiping down the boxes? My 7 and 6-year-old like to use them as toys, and I think we're not letting them do that. So you want to comment on that at all?
Yeah, that's a really good point. And it's something that I was just having a discussion with my family about yesterday. When you get that delivery of food from the restaurant, what about the outside of the container? The food inside is hot and should be safe, but the outside of the container may be contaminated. So a study was done by MIT where they actually took the virus and concentrated it, and then they aerosolized it and they sprayed it on different surfaces, and then they looked back to see whether or not there was virus living on those surfaces that they can actually demonstrate can cause infection. And what they did find is that if you aerosolize the virus and put it on various surfaces like cardboard, stainless steel, copper, plastic, it does survive. Copper actually, it lasts the least amount of time, just a few hours, but on cardboard titers can remain high for about 24 hours. Same with stainless steel. Plastic seems to last the longest, maybe up to 3 days. Now, this was an experiment where they were using very concentrated virus, so that's not to say that if somebody touches the outside of your container, it's going to last for three days. But it is possible. So the caution there would be, if you're getting a delivery and you don't know if it's been touched, use the same precautions that you might use if you were at the market and you were picking up groceries and picking up things off the shelf. Take whatever it is that you bought out of the container, get rid of the container right away if you can, and then wash your hands afterwards. Just treat it as if it's something that might be contaminated. Be careful with it. Don't be too afraid to touch it, but just know that, okay, now your hands might be contaminated, and so let's wash your hands after you're done with it.
Got it. That's great. Question from Ide in Carlsbad. She asks, I paid for a full month of preschool, and my hours have been cut by more than half at work. I paid $2,000 a month for my kids to be in preschool 4 days a week. This is a significant amount of funds for my young family. Are they supposed to refund our paid tuition for the rest of the month? How will they survive? Well, this is something that I'm hearing a lot in our community, and the cost of childcare now exceeds the cost of college tuition in many states. So there are ongoing conversations about what we need to do to address this, and this is, again, got to be part of this third stimulus bill that we're going to pass. The Senate Republican bill that I mentioned before provides these cash payments, but they're not nearly big enough to cover a situation such as yours. I think we've got to be far more robust in what we're considering, and we've actually got to do something that's going to make enough of a difference in people's lives where they're able to make ends meet. There are a lot of good proposals out there. I've told you at the beginning of this what my 5 priorities were for the third stimulus package. And again, I would go back to what my friend Joe Kennedy is promoting from the state of Massachusetts, which is that bigger annual direct cash payment, $4,000. And the other thing that I'll say is that it can't just be a one-shot deal. If the best epidemiologists and other modeling is showing that this is going to be a situation we're going to be dealing with for several months until we come up with a vaccine. Dr. Fauci and others have said 12 to 18 months, then whatever solution we put in place has got to last for that duration and has to keep as many people employed as possible. So I think it's really important that we provide whatever financial backstop to keep as many people employed as we possibly can. And then for others that are independent contractors or small business owners, we're already getting a lot of folks in our community who are saying they've had to close up shop because of this, particularly in industries that have been hardest hit, whether it be hospitality or tourism. So I'm mindful of all that, and as we work to construct a good bill that's actually going to try to address the problem, all that is on the top of my mind. And if you have other good ideas, don't hesitate to send them to us, to me or to townhallquestions@mikelevin.org. As for the preschool, you should know we're working with the administration to make sure that small businesses, like a preschool, have direct access to the funds that they need to at least try to make a situation like yours less onerous. And I think it's obvious that we're going to have a lot of stories like this, and we've got to do, I think, a lot bigger than we ever thought we would need to by virtue of the projections and the models that are coming out. A question for Dr. Garfield from Dean and Dana Point. Great question. When can we expect to have COVID-19 testing for anyone and everyone? And, I look at it like this. If we'd had the testing earlier, people could have gotten tested, and we could have prevented a lot of the social distancing measures that are taking place. And when you think of it, the cost and the pain of acknowledging what a big problem this was 4 to 6 weeks ago, or even 8 weeks ago, when you look at South Korea and the United States, we both had our first case of COVID-19 on the same day. South Korea got their best minds together early, and they ramped up testing capability. They're a country that has the population about 1/6 of the United States, and yet they have now tested well over 300,000 people because we delayed, and also because there were some issues with the initial CDC test, the reagent there, and because FDA and others didn't give a clear and bright signal to industry that this was going to be necessary, that we were going to need millions of these tests. There was a delay, and because of that delay, we've seen now community spread, and now we've seen these fairly draconian social distancing measures, and we're now talking about $1 trillion or more in necessary stimulus. So, when are we going to get the tests? Easy question, right, Dr. Garfield?
Yes,
I know
sure.
you've got the answer.
I wish I had a factory in my backyard and I can make them for you.
There you go.
Well, I mean, I have to say that this is unfortunately one of the consequences of underfunding preparedness. You know, I think that that you know the CDC is well equipped to be prepared to produce tests, to work with their colleagues in other countries in order to see what's coming and be able to anticipate. And unfortunately, this time we just weren't quite up to snuff on it, and so we're now playing catch up. And I think the CDC has produced tests. I know several state and local health departments have been allowed to start producing their own tests, and now private industry has been pulled in to take advantage of their resources to be able to increase the number of testing. So we're working on it. We're trying to get the tests out there as quickly as we can. I unfortunately don't have the answer for Dean as to when that will actually happen, but it is increasing. And so in thinking about the testing, what I think it's also important to understand is, what does it mean to be tested? The test itself is testing for the virus. And so if a person is infected, and they have a virus in them, the test will show positive. If it's negative, it doesn't mean that they hadn't been infected in the past and now they're over it, and it doesn't mean that they can't become infected in the future. And so it's been important to test people who are at highest risk of having COVID so that we can pick up those cases as quickly as possible. So, and that's started with people that have symptoms, fever, dry cough, headache, body ache, and had some other indicator to suggest that it's COVID as opposed to the flu or some other cause of these kind of symptoms. And so that was why only people who were a known contact or people who had been traveling to places with endemic disease were being offered the test. So it sounds a little restrictive, but that's what we needed to do in order to preserve the tests that were available.
We just didn't have enough tests.
Exactly.
And so we had to have very restrictive guidelines. And then we broadened the guidelines, which was good, but we still didn't have the tests.
Right. And now we're starting to, backfill with the number of tests, and that will help to get more people tested. I think it's going to be very, very helpful for us epidemiologists, because once we actually are able to test and know for sure which people have and which people don't, then we're going to be able to really start to understand the magnitude of the epidemic. Not only who has it, but we'll be able to actually look at the rates of disease, and we'll be able to know what proportion of the people that are dying or what proportion of the population that are sick are actually being hospitalized and dying. Right now it seems very dire because we're really only testing the people that are sick and are in the hospitals until we actually test a broader cross-section of the population.
Well, one of the things that they're doing in Israel right now is they're using one test for multiple people. They're combining different samples into one test. I think it's 48 people, and then they're able to tell if any, and then if it tests positive, then they go back and of course they test all 48 people, but they can at least try to isolate where COVID is, and they're a country of 8 million. And when I asked why aren't we doing that here, the reason is that we don't even have enough tests for people who are fully symptomatic, who meet the CDC's criteria for testing, much less to do something on a broad scale the way they're doing in Israel. So I do think, however, that we hopefully can learn. I think it would be such a massive mistake for the United States to think that we need to go this alone. We need to get the best and brightest people from all around the world, and we need to make sure that we understand from lessons positive and negative things that other countries have experienced. whether it be China, South Korea, Israel, or other countries where they're experiencing this. Germany, of course, has been very proactive. We want to try to use the best practices here in the United States. Unfortunately, we're already behind the curve in terms of allowing community spread and not having the tests that we should have had from the beginning. Question from Rufus in Oceanside. Rufus asks, I have not seen where truck and forklift drivers are being supported or cared for. Please don't forget them and their families. Without them, no toilet paper or respirators or produce or anything else. We need to make sure they can have health care and pay their bills and not be fatigued. Well, Rufus, I'm incredibly grateful to all of our truck drivers and delivery drivers, because you're absolutely right. You're the backbone right now of being able to provide basic necessities to our communities, and we're incredibly grateful to you, and we need to do all we can to make sure that you are taken care of, that you've got a living wage and a secure retirement and good health care. And aside from all that we're doing with COVID-19, I'm absolutely committed to making sure that that's the case for all of you that are working so hard. And I'm truly grateful to everybody also that's stocking the shelves at the grocery stores and at the pharmacies, and of course for all of our healthcare professionals who are putting the health and safety of others ahead of their own health and safety. We're just incredibly grateful to everybody that is really sacrificing so much to make sure that we can get through what will be a very difficult next several months. Question for Dr. Garfield from Monica. I don't have a city for Monica, but Monica asks, is it safe to swim in an unoccupied condo community swimming pool and hot tub? Interesting question.
That is an interesting question. Thank you for that, Monica. As the father of a daughter who swam from probably the age of 4 until she graduated from college, I know how important it is for some people to be in the pool, and I think this is a good question. The CDC has stated that there's no evidence to support that there is transmission from pools. Now that said, there's a lot of factors that go into that. One is the pool or the jacuzzi being maintained with the proper levels of chlorine to make sure that any bacteria or viruses that are in them are being killed. The other thing is really more of a personal opinion, which is that, you know, when you're in the water, you tend to get water in your nose, and so it drains, and you're touching your face. And then when you get out of the pool or the jacuzzi, you might be touching that railing to get out. You might be touching the sides of the pool or the jacuzzi, and you don't know, even though there might not be somebody there when you're there, you don't know who was there before you. And so I think that the risk is probably pretty low, and I think you have to assess that risk yourself. But I don't think it's zero. I mean, I think that there is the potential there where somebody who was sick with coronavirus could leave some virus behind, and you may come in contact with it when you follow them up. So I would be careful.
Thank you for that, Dr. Garfield. Question from James in Oceanside. What is going to happen with health insurance when people have lost their jobs? Nobody's going to be able to afford to pay for COBRA. It is outrageously expensive. Well, I asked Speaker Pelosi this very question. I think that any COVID-19 related legislation is going to have to address this issue. What I can tell you is that Covered California, which is our exchange under the Affordable Care Act, now has opened a new window, a new provisional window where you can apply for Covered California. Clearly there's a cost associated with that as well. So I am incredibly mindful of this. You know, there are proposals out there that I've seen that I think are very interesting that we have to take a real look at to expand Medicare benefits for all things related to COVID-19, as an example. But your question is extremely well taken and something that I'm thinking about as we craft this legislation. Peter in Encinitas asks, he says, Mike, I am troubled because I have not heard from government leaders a review of the cost-benefit analysis of all this. Leaders such as yourself appear to advocate public health and safety at any cost. Well, I think the way I look at it is fairly simple. We've got, as I said before, two directly interrelated crises. We've got a public health crisis and we've got an economic crisis. And the best way that we can address the economic crisis is to deal with the public health crisis. There's no question that social distancing and closing a lot of businesses and making it harder for other businesses, that has a huge economic toll. But if we were to look at some of the scenarios that we've seen, whether it be the ones from our own CDC or from the recently released one in Imperial College in the UK, we're talking about hundreds of thousands, if not millions, of Americans who will die as a result of this virus. We also don't know the long-term potential impact on people's health with this virus. If you get COVID-19, we don't know long-term what that's going to do to you. And so, you know, I think we don't want to take that chance. We don't want everybody to get infected. The New York Times ran an analysis this morning saying that if we did nothing, roughly 85% of our district in Orange and San Diego County would be infected with COVID-19 in the next couple of months. I believe the deadline or the date that they gave was May 10th. And we know from Dr. Fauci and others and all the research that COVID-19 is at least 10 times more deadly than the flu. So I cannot stand when I hear people say, oh, it's just the flu. It's not just the flu. It's something that we've all got to take seriously. It's far more deadly, far more harmful than the flu, and something that we all really need to, if you're one of those people that doesn't think this is for real, you really need to wake up, because it's very much for real. Doctor, anything to add to that?
I would just second that our best hope of preserving the economy is by staying healthy. You know, a population that has dealt with a crisis, whatever the crisis is, when people have their health, they can rebuild. If you're not healthy, you're not going to be able to rebuild it. So I think the public health is first and foremost.
I guess the last thing I would add is the whole concept of flattening the curve. You want to flatten the curve to prevent community spread, so that you don't overrun our healthcare system, so that you don't have doctors such as yourselves making a decision whether or not to keep people alive or not because you have inadequate medical facilities and equipment to keep people alive. And that's the last thing that we want. And of course, when you have overrun medical institutions and facilities, then you're not able to take care of people who have nothing to do with COVID-19, that have other ailments and issues that come up every day, whether it be cancer or heart disease or whatever else. And so it's critically important that we get our hands around the community spread and try to prevent and delay as much of that as we can, so that the healthcare system is not overrun. We also need those policies in place, the stimulative policies that are going to help prevent companies from laying everyone off to whatever extent we possibly can. In the UK, what they're doing is they're paying thousands of dollars a month, I think it's 80% of what people would normally make, to employees to try to keep those businesses up and running. And yeah, it has huge costs associated with it, but the thought of hundreds of thousands or even 1 million or 2 million people dying, according to some of the modeling, that's unfathomable to me, and unacceptable in a country like ours with the resources that we have and the ingenuity that we have. Of course, we're also counting on the best and brightest in healthcare as well as in innovation. Here in our district, we've got some of the great innovators in biotechnology and life sciences I'm in touch with every day who are working on the next drug to try to help alleviate some of this. So, excellent question, though. Next question for you, Doctor, is from Monica. Can our pets spread the virus?
It's a really good question, Monica, and fortunately, it looks like the answer is no. There has been studies that have been done to try to find good animal models to be able to test, diagnostic tests and treatments for COVID, and dogs and cats have been looked at, and it looks like they are not susceptible to the virus. So you don't have to worry about your pets being infected with the virus and transmitting to you.
Another question for you, Dr. Garfield, from Adam in Cardiff. Is anyone testing combinations of existing anti-flu medications with anti-HIV medications to treat the coronavirus?
Well, it looks like the flu medications like Tamiflu are not effective against the COVID virus. However, there is a drug called remdesivir, which was used for the Ebola virus, that looks like it's effective against COVID in laboratory studies. It's currently being tested out with people, and it looks like it's got some promise in being effective in treating the disease. And Gilead actually is the company that makes this drug, and they've made it available to patients that are on ventilators under their compassionate use protocols, so it is being used to a certain extent. There are studies going on with it. In terms of other HIV medications, I think that there aren't any that are have been found to be effective, but these studies are going on right now.
Thank you for that. Next question from Olivia in Oceanside. When does it look like people will be able to resume going to work? Great question. Number 2, who qualifies for financial help and how do we go about getting that? I'm worried because I'm self-employed and I'm wondering whether I'll qualify. So it's a great question. In terms of when you can resume going to work, your guess is as good as mine. Any thoughts on that? We're going to need social distancing for some time, and non-essential businesses, I imagine, are going to remain closed for some time.
Yeah, and I think that in addition to the social distancing now, hopefully we will start to see a decline in the number of cases. But once that happens, when everybody goes back to work, the people that haven't been infected yet are going to start coming in contact with people that might still be shedding the virus, and we can get a second wave. So I don't think this is going to be the kind of thing where we're going to just say one day, hey, it's over, and we can just stop. I think it's going to be a practice that we should be used to and maintain it. Hopefully the schools will be able to open before too long, and some of these other non-essential businesses like gyms and yoga studios will be able to reopen. You know, another area that's been heavily impacted are elective medical procedures. Going to the dentist, going to the doctor for non-essential medical care, and I think that there's going to be a big need for that. And so I think we're going to have to be conscious of social distancing, and I think that there's going to need to be some protocols put into place as these businesses start to come back online to make sure that we're careful and we're not going to create a big second wave.
With regard to the paid leave, what I thought would be helpful is if I just highlight what was in that family's first bill that we've already passed. Starting April 2nd, self-employed individuals will be eligible for the emergency paid sick leave and family leave policy that's covered with a refundable tax credit. If you're sick or seeking care for yourself, you can earn the full amount you're usually paid, up to a maximum of $511 a day for 10 days worth of work. If you're caring for a sick family member or a child whose school or daycare is closed, you earn 2/3 of your usual pay, up to a daily limit of $200. The program also provides 12 weeks of paid leave at 2/3 normal salary to people caring for children whose schools are closed or whose child care provider is unavailable because of COVID-19. If the self-employed employed individual's tax liability exceeds their credit, the outstanding amount will be paid to them in the form of a refund. So I hope that's helpful to you. Question from Julie in San Juan Capistrano. If everyone was tested with and without symptoms, so if everyone was tested, it would lower the contagion spread. 4 out of 5 persons who contract the virus were exposed by an asymptomatic person with coronavirus. Therefore, why isn't the government testing everyone and isolating those with the disease? It would stop the spread. All we need is enough tests for 330 million people.
Right.
And therein lies the problem. So this is as frustrating as can be. And again, every time that we get a press conference from the administration, we hear the tests are right around the corner. We've been hearing that in briefings in the halls of Congress now for going on a month. And unfortunately, because of some of the things that were done 2 months ago, which I don't need to recite all of them now, you can very easily Google and you can see the articles that have been written in a variety of sources about some of the missteps that were made. That's all in the past, but that's why we are where we are, and now we've got to ramp these tests incredibly quickly. And I'm encouraged that a lot of the solutions are coming from right here in North County, San Diego, and in South Orange County from companies like Thermo Fisher and others that are really trying to ramp things as quickly as they possibly can. But it's incredibly frustrating. Any more to add on testing?
Yeah, not to scare anybody, but it's even if you tested everybody, there will be some people who will test negative, either because it's a false negative or because the virus enters into the lungs, it infects the cells in the lungs, and it might be a couple of days before the virus actually rises up into the nasal pharynx, which is where we get the sample to test. And so it could be that somebody could actually be infected before they will even test positive on the test. So I think we can't rely on the test to be 100% of the solution. The other thing is, as I mentioned earlier, is that the test is looks for the genetic material in the virus, so it's looking to see who actually has virus in their nose or throat. But it doesn't tell you who's already been infected. So if somebody had been infected and is now what we believe they would be immune to becoming reinfected, we wouldn't know that with the current test that we're using. What we would need in conjunction with the PCR test is an antibody test. And antibodies are produced by our bodies after we've been exposed to a pathogen, and it's how we fight off that pathogen with the initial infection, plus it provides us some protection if we're re-exposed. Those antibodies remain in our blood for a period of time, hopefully a long time, so that we have protection. But if we test for that, then we can actually see who may have already been infected and who potentially is no longer susceptible to infection. And so I think we need a combination of the test for who's actively infected now, which is the PCR, and that's the test we're doing. And we also need to develop an antibody test so we can screen the larger population and find out who's been infected, so we can really see where this virus has been. That antibody test is not available yet. I know a couple of companies are working on it, and I'm hoping that they'll be out soon, because I want to be one of those investigators that's using them to try to understand the epidemiology of this epidemic.
We've got several questions that have come in on Facebook during the broadcast, and they're medical in nature. But they're ones that I know that you will be able to provide more insight than I. Anna asks, Dr. Garfield, what is the possibility of contracting the virus while grocery shopping?
Currently, I think it's low, and that's why the CDC has not advised people not to go shopping. I think while you're in the market, it's important to maintain a safe distance from other people. The virus, as it's spread person to person, can be spread through coughing or sneezing. And when that happens, we aerosolize some of that virus into the air in droplets, but those droplets are heavy and they fall to the ground pretty quickly. And so if you're 6 feet away from somebody who's coughing or sneezing, the likelihood that you'll breathe some of that virus in is really small. The other risk comes from touching surfaces. So when you go to the cashier and you're putting your groceries on the belt and you're touching the keypad to put in your credit card and all these actions, these are places that other people are touching. And if somebody is sick while they're shopping, they may be contaminating these surfaces. You touch them, and if you touch your face or nose or mouth, you could be exposing yourself. And so what I would tell people to do is go in, do your shopping. Hopefully they'll have some disinfectant wipe for the shopping cart, but I wouldn't trust that, that's not the only thing you're touching. So don't touch your face or your mouth while you're shopping. And when you're all finished, go out to your car, put some hand sanitizer on. I think it's also not a bad idea to have wipes in your car so you can wipe down your steering wheel or anything, so you keep the inside of your car clean. And then when you get home and you take out all your groceries, wash your fruits and vegetables, put away everything, dispose of the bags perhaps. Just be aware that some of that material that you're bringing home might be contaminated, so just touch it carefully. And again, wash your hands frequently.
Another one from Mira. If you believe you were exposed to someone who has the virus, do you self-quarantine for 14 days? And after 14 days, are you still contagious?
It looks like the incubation period for this disease is about 5 days. So most people who are exposed will start to show symptoms within about 5 days. It could take longer, up to 2 weeks. And so that's why we recommend a 2-week isolation period to see if you develop symptoms. The virus has been shown to be detectable in people up to about 2 days before they develop symptoms, and typically about 8 to 9 days after they've started to show symptoms, so as they're resolving their infection, although that can actually extend 14 and even up to 21 days. So after a 14-day isolation period, if you haven't been sick, you're very, very unlikely to have been infected, and you're not going to be infectious to others.
Tony from Capo Beach asks an interesting question. What steps are being taken to alert those who may have been contacted or infected by those who are convalescing at home, who's tracking cases that don't enter hospitals and ERs? So sort of what's the manner of contact tracing? I guess what would be ideal contact tracing to make sure that, if you contacted somebody that is under home quarantine who tested positive, that you're not going to be at risk?
Right. That's a really excellent question, and it's something that I would love to speak to somebody at our county health departments about to find out what they're doing. Normally with an infectious disease such as this, when a case is detected, it's reported to the health department. The health department will usually send out a disease investigator or call the person to find out more about the case, find out who they've been in contact with, see who else needs to be tested or offered care. In this situation, there's because people aren't being tested, oftentimes, like you said, somebody might be sick, they're home quarantined. The health department may not know about that. Even their doctors may not know about it. And so quantifying these cases and doing the disease investigation, I think, is something that we're trying to get a handle on. It's a really good point, and I think it's something that, like I said, I think our county health departments could probably answer that question better than I, and I'll definitely look into that. But I think it's something that there are certainly cases that are self-quarantining, and nobody really knows about those cases because there's no reporting system for that right now.
So there were a few really good policy-related comments that I just wanted to mention, and I agree with all of them. Will there be financial assistance for churches and synagogues? As I mentioned, the nonprofit community has been very hard hit, and that includes our places of worship as well, so I'm very mindful of that, and that's one of my 5 principles for this new bill. What happens to gig workers? I think we mentioned that. That's Michelle's question. Absolutely critically important that we take care of gig workers and independent contractors. Anna Heisel says small businesses need cash now to make payroll, not future tax credits. Anna, I agree with you, and we're going to fight for that. Michelle asks or says credit bureaus should not be reporting late pays during this time. I think that's a great point, and I agree with you, and I'll follow up on that. Shapar asks, Doc, this be for you. If a person test positive for coronavirus, hands over a document to a healthy person, how contagious would that be? I am told to self-quarantine because of this situation. So can you transmit this with paper?
I don't think that study's been done. I think, I think that the amount of virus that might have been transmitted or been placed on that piece of paper and then picked up by the other person is probably pretty low, and the chances that somebody might touch that piece of paper and then touch their face afterwards might be pretty low. I think that if it were transmitted that easily, we would already have way more cases than we already do. So fortunately, I don't think that that's a big risk, but it certainly makes sense. If somebody's been signing papers and coughing and sneezing on them, and or maybe touching their face and then touching the pen that you're using, I think we want to be careful with that, and wash your hands or use hand sanitizer afterwards.
Thank you for that. A couple of interesting questions from South Orange County, one about property taxes, one about the use of a closed hospital in San Clemente. With regard to the property taxes, basically what can we do to try to delay the property taxes that are due in April? This is a huge issue because the counties are saying they don't have the authority to be able to delay collecting the property taxes. So we wrote a letter, the congressional delegation up in Orange County wrote a letter that was on the front page of this morning's paper up there. We were basically told that the county felt it didn't have the unilateral jurisdiction to do it, so we're going to be working with the governor's office tomorrow or Monday to make sure that they get the message loud and clear, because it's not just an Orange County thing, it's a San Diego County, all throughout California, where thousands and thousands of dollars of property tax bills are coming due. The IRS, you've probably seen, they're offering a delay in paying your federal taxes, and our controller Betty Yee is doing the same with regard to state taxes. You can go to the IRS website, or you can go to mikelevin.org. We've got a whole COVID-19 resource page that includes the link to the IRS, where you can see more information about that new filing deadline. The other question from South Orange County: is anyone investigating the use of the currently closed and boarded up hospital in San Clemente to house patients of COVID-19? That's a great question, and I will reach out to Orange County officials on Monday morning, or perhaps even tomorrow. We have a morning call, and obviously that hospital has been pretty controversial for a while. It was closed down some years ago. But maybe to you, Doctor, do you see in California right now, as you look at our hospital capacity, do you believe, Governor Cuomo in New York and some others have said the Army Corps of Engineers need to be activated right now to build pop-up hospitals? We need to be using facilities, maybe closed hospitals or other buildings. I've got property owners here in North County, San Diego, that have offered their properties for use as temporary hospitals. Any comment on whether you think that's needed right now in Southern California?
Well, I'll just say that in my experience working at the CDC and watching the WHO and how responsive we've been in emergency situations such as Ebola, I think our Army Corps of Engineers is absolutely outstanding, and I think that they have the ability to set up a hospital rapidly if necessary. And I think it's important to assess where the epidemic is occurring and figuring out if we need to build one, we should be prepared to do that and call in the resources that we have available to do that so that we can get it done quickly. I think China, part of their response was by building 2 new hospitals so that they can handle the load of patients, and they were able to isolate as many patients as possible in hospitals rather than sending them home. Because as I said before, most of the infection was occurring in households. So somebody gets sick, and next thing you know, you have 2 or 3 more people that are getting sick. So if you can find the people that are sick, isolate them, whether it's in a hospital or some other environment where they can be safely separated from others until they convalesce and are recovered, we can really get a handle on the epidemic by providing spaces to really let people recover safely.
A couple more for you, Doctor, and then we'll start to wrap up. What is your opinion? This is from Kathy. What is your opinion of the private COVID test via Everlywell, which goes live tomorrow, apparently? Believe the kits, she says, I believe the kits only have 1 swab. Distribution is dependent on telemedicine and ability to pay for the test. Any thoughts about that test?
Well, I've seen that test online, and I think it's exciting to see that there's an option for people. I don't know anything about the sensitivity and specificity of the test or the quality of it. I think in practice there are other kinds of tests that are being done through home delivery. So the test kit is sent to the person's home. They take the sample themselves. They put it into the package. They send it back to the lab. The lab does the testing, and then they report the results back either on a website or maybe a phone call or some other method. If it works, I think it's fantastic. I
maybe by this time next week, we'll do this next week, and we'll see if that test is out there and people are using it. But my understanding is people have to pay out of pocket for it, correct? And it's not cheap.
I believe that's the case. I mean, unless the president's declaration that all testing will be paid for, if this can come underneath that mechanism, then maybe people won't have to pay for it themselves.
That's something we've definitely got to keep an eye on because we want all the tests to be free. Donna asks, is there an ICU protocol for coronavirus patients with type 1 diabetes? Without frequent monitoring, we're subject to dangerous lows or highs.
That's a really good question. I'm sorry, that one's out of my bailiwick. I'll have to defer on that one.
We can figure it out, and we can get back to you perhaps next week. We're just about out of time, and I want to thank Dr. Garfield so much for making yourself available this afternoon. I'd love to do this again with you. We're going to, hopefully do one of these a week while we're going through this crisis, and it really is a moving target, and your questions have just been outstanding. Wanted to ask you if you had any closing thoughts or closing statement for our viewers.
Wash your hands. I think that a couple of points I did want to make are, one is when you do get home from the market, wash your fruits and vegetables. Cooking kills the virus, so don't be afraid to eat. It's really important that we all stay healthy. So, cook your food and you should be fine there. It's important to get out and get exercise, stay healthy in general. It's okay to go out of your house and take a walk, take your dog for a walk. But if you run into your neighbors, keep a respectable distance, and so that you're not coming in contact with people. And again, be aware that when you're out and about, other people might be out and about too, and they might be touching some of the things that you're coming in contact with. So use good hygiene precautions when you get back home. And then the other thing I want to say is that there's a lot of tools available now to help us to stay connected, even though we're being socially distancing. So there's video conferencing, there's phones, there's webcams that you can use. So stay in contact with your family. Make sure you're keeping tabs on your loved ones. You don't have to go over to their house and potentially expose them. But check in with your seniors on a regular basis. Make sure that they're okay. Make sure that they have access to food. If if they're not getting home deliveries, maybe you can go pick up some groceries and leave it on their front porch for them. But use the technologies that are available. I think we're going to see a real boom in telehealth after this, and I think it's a good thing because I think we've got tools available to us. We've been a little cautious about using them. Obviously, privacy and security are really important, and I think we've got to get that right, and how that information is being used and protected. But I think that there's a lot of good tools out there to help us to get good quality care without having to actually be face-to-face with a doctor. We can use.
Let me ask you a question that our family is dealing with personally, and I know many families are dealing with that are watching this, which is we've got our relatives. My wife and I both have our parents are in good health. My mom and dad live literally right down the street from our house. They're 75 and 74, and if they're watching, I love you, Mom and Dad, but I haven't gone to visit them, and I don't know when I'm going to be able to go and visit them. What would you advise to families like mine, where we've got 2 young kids, we're all healthy, we feel fine, but we don't want to put our parents, and I'm sure that goes for so many in our community, we don't want to put people unnecessarily at risk.
Absolutely. This will end. We'll get through this, and you'll be
better,
able to
Doc.
see. It better. Well, we all have to pull our weight to make sure that we get to the other side in pretty reasonable shape. But I think that this is something that it's not going to last forever. But we have to pull our weight, and we have to do our part to get through this. And so I know it feels terrible right now not to see our parents. But like I said, we've got phones, we've got we've got web apps, we've got lots of ways that we can stay in contact. This is a good time for some of the Luddites out there and some of the senior citizens that have avoided technology to maybe give it a try.
I got my 75-year-old mom to figure out how to use Skype.
Nice.
So that's a big deal. that was a big accomplishment.
Yep. My 86-year-old mom is texting me these days. We got her doing it too.
Let me ask you another question. What do you think the best message is for our children? So again, we've got young kids at home, and they know obviously mom and dad are home all the time, which they're not used to. They're particularly not used to me being home all the time because I'm usually in Washington 135 days a year. But what do you think the right message is there? It's so difficult for so many of our children. And the schools are doing a good job with regard to distance learning and setting all of that up. But do we tell them perhaps that it's going to be several months? Do we tell them that it's going to be weeks? My son is eager to see his friends. We've been clear that play dates are not going to be part of the picture for a little while.
Yeah.
What do you think the best message is there?
Yeah, the hard part about that is that the older you get, the faster time goes. So when you're talking to kids, a month feels like forever. So this is a challenge for them. But I think that honesty is always the best, and you have to judge about how much information your kids can really absorb and understand. But I think in general, we found that children are pretty smart, and when you're honest with them and explain to them what's going on and why it's important to wash their hands and why it's important to keep distance, and that eventually this will go away and they'll be able to go back to what they were doing before, I think kids get it. And it's probably better to be honest and be able to explain it, because as things change and you have to sort of change the message, it's going to be much easier to respond effectively to that to a change when you're being honest than if you've been, making up stories. And then all of a sudden, new information comes out, we have new restrictions or new things that we have to do, and then trying to be consistent with your kids if you're not being frank with them is going to be challenging.
Thank you for that. And we've had a couple more questions come in literally in the last couple minutes, so I'll try to get to them. One question was excellent about the homeless. That's a very at-risk population as it stands. We're obviously working very hard beside COVID-19 to try to address homelessness in our communities. But can you speak to how great of a risk that is for our community, the community spread within the homeless population, and what do we need to do to address it? Is it providing emergency housing? Is it something else?
Yeah, I think housing would be crucially important. I mean, people who are homeless oftentimes have other underlying health conditions. So in addition to being at greater risk for exposure because they may not have the ability to wash their hands or buy hand sanitizer, they're really at high risk of becoming exposed and exposing other people because they're sick, and they have underlying health conditions. So that population alone could end up being a major drain on the healthcare system if they're all of a sudden becoming ill and requiring ventilators and hospital beds. So if you think about it, I would much rather spend that money putting those people into a safe shelter where they can, take care of themselves, take care of their health, practice good hygiene, get a good meal, and stay healthy, and not add to the problem of having our hospital beds being filled up, but actually give them, a place where they can have a dignified, place to stay and stay healthy and, be part of the solution and not part of the problem.
I know that San Diego, they have a Ramada hotel in Kearny Mesa that they basically made the whole hotel available to anybody, including the homeless, that is demonstrating risk factors for COVID. Couple other things. One, are you more concerned about the lack of hospital rooms, beds, or ventilators, or masks, or all of the above?
It's really all of the above. There's not enough ventilators for every room, and there's not enough rooms for everybody that potentially needs to be hospitalized. And we can't forget that there's people that need hospital beds for other things. Unfortunately, we still have heart attacks. We still have, people that have other health conditions that require hospital beds. And in this country, we tend to be very efficient with our hospitals, where we are usually at about 90% occupancy. So it's not like we have a lot of hospital beds sitting vacant waiting for people to fill them up. And so I think that's important. And then as far as masks, we are experiencing a shortage, and we really need to make sure that they're available to the first responders and the healthcare providers that need to protect themselves so that they can continue to, serve the public. So in terms of, wearing masks to walk down the street, it's unnecessary. Even wearing masks going to the supermarket. If you're somebody who is highly susceptible, you've got underlying health conditions, diabetes, immunosuppressive conditions, yes, it might make sense to wear a mask. But for the majority of us, it's not necessary. And in fact, it's been shown that people who wear masks tend to touch their face more often because they're trying to adjust the mask, and maybe they're going to put themselves at greater risk by using the mask. So let's keep those personal protective devices available to the people that need them. And I know that there's been a big push to have the manufacturers trying to crank them up faster. And I've also just recently read that all of the clinics that are shut down because they only do elective procedures have been asked to donate some of their personal protective equipment if they're not using it now, so that it's available for the hospitals.
Thank you for that. Can you speak to, there have been some email threads and social media threads. There's all kinds of interesting misinformation sometimes that gets spread around, but a couple people asked about ibuprofen. There was some rumors that ibuprofen somehow was bad to take if you're COVID-19 positive, that it could somehow exacerbate the symptoms of that. Any validity to any of that?
Yeah, I have read a little bit about that. it's not, I don't treat patients, and so it's not something that I deal with a lot, but from what I understand, there may be some increased risk. There's not a lot of strong evidence to show exactly what that risk is. I think more of that information will be coming out, and I'm happy to do some more homework on that and get back to you on it.
Perhaps by next week. Another kind of a CDC question, which is interesting because that's your former employer. Roseanne asks, since we're not getting enough testing, are you concerned that our projections for an appropriate plan for now and the future will not be accurate? Who is following the data? Do we have enough people in the CDC or where this data is normally collected now to do that extremely important work?
That's a really good question. Who's doing the projections? Where's the data coming from? It's really actually a combination of experts getting together and doing the work. Oftentimes the modelers are in academic institutions. I know Johns Hopkins University and Harvard and others are doing modeling. UCSD has modelers that are working on projections for where things are going. But that is all dependent on the data that we have available, as the commenter had noted. And we get that data from the Centers for Disease Control, from the World Health Organization, from local and state health departments. Everybody's working to try to make that data rapidly available. Johns Hopkins University has a website that actually is consolidating data from a lot of these sources and putting it onto a map so you can actually count on a day-by-day basis where the cases are around the world, and it's an excellent resource. So the models and the projections will get better as we have more data, but right now the models that are available are giving us our best chance of being able to anticipate what will happen and to try to be responsive. And so I don't think we should discount the validity of the models that we have, but recognize that models will change, and hopefully they'll change for the better as we respond appropriately.
I got a couple of questions about foreclosures and evictions. I have called for a nationwide moratorium on foreclosures, and we actually wrote a letter last week on that. Just the same, I applaud the efforts at the local government level on evictions, and I think that you're hopefully going to see more and more local jurisdictions that are going to take initiative with regard to that. If it requires federal action, I know that we'll be working on that next week, at least temporarily, to make sure that there's sufficient forbearance for anybody that might get behind on a mortgage or be at risk of being evicted. Obviously impossible to shelter in place if you don't have shelter. So yes, we want to make sure that we don't do anything to unnecessarily harm people. And another question for Dr. Garfield from Dennis. Dennis asks, I have an 83-year-old family member who's undergoing chemo treatments for cancer. In multiple ways, he is compromised. Is it simply a matter of time for him to come down with this, or do we see a steady state herd immunity outcome?
Dennis, that's a really good question, and I hope for the best for your family member. We will get to that point where enough people will have had the disease that we will have what we call herd immunity. And what herd immunity is, where there's enough people who are not susceptible, either because they've had it before, maybe they've been vaccinated, that if somebody is infected, they can't transmit it to any of those people. And then if there's somebody who is uninfected, but everybody else around them is immune, then nobody with the disease can transmit to that person who's uninfected. And that's really important when it comes to people that, when the vaccine comes out, who can't be vaccinated. There's always certain groups that either can't mount a good enough response or they can't be vaccinated for other health reasons. Enough of us need to be vaccinated and protected so that we do get to that point of herd immunity where those people will be protected. So in terms of, I don't think it'll happen right away, that we'll have enough people that are no longer susceptible that will get to that point of herd immunity, but we will eventually. And I think that for now, it's really important that all of our family members who are really susceptible need to be protected. They need to be kept kept it out of contact of other people who are infected so that they can get, be here with us until that happens.
What's your best guess on how long immunity will last? So if you do get COVID-19 and you're healthy, otherwise healthy, and you get through it, how long are you immune before you are at risk of getting it again?
Yeah,
do we just not know yet?
We really don't know yet. With the common cold, we know that immunity does wane over time, so that's why we continue to get the cold. But that's a virus that has been in humans for about 800 years, so we've learned, our bodies learn not to overreact to it. Until we actually have people who've been exposed to COVID and we have enough time to do some studies to look at antibody levels, we really don't know.
And would you envision that, finally we'll get a vaccine? We think, it's 12 to 18 months probably to get that vaccine, that this would just be something that we would, like we get a flu shot every year. Everybody needs to get their flu shot. But we would get a COVID shot as well, or what would that work?
Yeah.
How would that look? Would it be something we do as children, or?
Well, hopefully we won't. Hopefully this will be more like, Ebola or MERS or SARS, where the virus came from bats, and it, in the case of SARS and MERS, it went from the bat to a civet cat or a camel. This one, we're not really sure. We think it might have been a type of an armadillo, and then humans got exposed to that animal transmitted to the humans. And that's not something that happens on a regular basis. So if we can control this pandemic and we can let it run its course, and we vaccinate people that are sick, or that are around the people that are sick, so that it doesn't transmit anymore, once it dies out, we're not going to need to be revaccinating everybody on an annual basis.
A couple of economic questions from Arshad and from Denise. Arshad asks, in my family, everyone is safe and healthy. Most people have lost jobs, including me. I'm sorry to hear that, Arshad. That means we don't have health insurance. We don't know how to pay our mortgage or rent and other bills. Unemployment will not cover it. Can you please do something so that we don't have to pay our bills for a couple months? And when everything is fine, we'll pay bills that we pay now. I know everyone is very stressed, including you. I hope and pray I hear good news from you. Stay safe. Well, thank you for that, Arshad. I do think we're talking about a variety of different proposals to provide a direct cash payment to hardworking Americans such as yourselves, so that we lessen the economic burden that you're going to have in the coming months before we're able to end at least the most draconian of the social distancing measures and the shelter-in-place type of measures that we've had to impose. But we know that we're going to have a period of time where it's going to be very difficult for people. I can tell you this: there are some people, some companies that are hiring in North County, San Diego, Amazon and other companies that are delivering things all over, and grocery stores and things of that nature. If you go to to my Twitter feed, at Mike Levin, I retweeted the other day a link, and we'll make it available on our website as well, from the North County San Diego Economic Development folks, with some businesses that are currently hiring. I know Amazon has said they want to hire up to 100,000 people. That being said, I get it, and absolutely committed in this third stimulus to dealing with reality. And I think we're not going to just pass whatever Mitch McConnell and the president come up with. We want to do the right thing by the working men and women of this country, and make sure that we're taking care of people in a way that's going to be sustainable. Denise asks, I'm hearing from friends who work for a national hotel chain that they're being placed on 0-hour weeks due to the coronavirus. When they go to apply for unemployment in both California and Oklahoma, their company contacts are telling them that they have not been laid off and are therefore not eligible for unemployment. Is there some way that these hardworking people can become eligible for their earned unemployment benefits? I'm so sorry to hear about this. What I would encourage you to do is try to apply for unemployment insurance. If you have zero earnings in the prior week, you're not working this week, as no fault of your own, you should be eligible for unemployment insurance. But that's where I would start. But make no mistake, this is going to be a huge issue in the months ahead, and that's why we need both expanded unemployment insurance as well as family and medical leave ramped up in a big way to try to help as many workers as we can. And as I mentioned, what they're doing in some other countries like the UK is they're providing that direct cash payment, roughly equivalent or 80% of what the worker would otherwise make at their full-time job. So that's why we're working with the administration, with the Senate, to try to get a bill that's actually going to be up to the magnitude of the crisis that we face. Carl in Carlsbad asks, and maybe we can both take a crack at this, is there a way to encourage all auto manufacturers to help ventilator and mask companies either through supply chain assistance or even through contract manufacturing? Ferrari and Fiat are already in similar discussions with ventilator makers in Italy. I'm confident this all hands on deck can-do spirit will promote American goodwill across the world. Doctor, what do you think about some of these car companies and others that are going to be manufacturing? I know some are doing other things, but the ventilators are going to be critically important. Mm-hmm. Does that make sense, the all hands on deck?
Absolutely. I mean, I think that there's a lot of smart people with a lot of capabilities. Certainly there are people who are being laid off of their jobs right now because the job that they're doing is can't be done right now, and so if there's some other industry that they can be put into at this time, I think that would be great. I think that it'll be really important that whatever they're manufacturing is being manufactured to the same standards that they would normally be held to if they were creating, medical devices and things like filters and ventilators. And so they're going to have to work with the FDA and the other regulatory agencies to make sure that the products that they're making are actually safe, because if not, they could be creating
More
new problems. Yeah.
Well, I certainly believe we need to use the Defense Production Act as quickly as possible. I know the President's talked about it, but I think he's actually got to do more than talk about it and put it into action right away. If not now, then when would you ever have the need to do that? So we need our great companies in the United States producing whatever is needed to try to get out in front of this as the spread continues to grow and the supplies continue to run out. I wanted to, again, thank everybody for tuning in. We had hundreds of people tune in. I want to thank my wonderful wife, Chrissy, who is the love of my life and who also now has to put up with me at home far more than she's used to. I want to thank my wonderful kids, our great kids, Jonathan and Elizabeth, who are just wonderful. My in-laws, who are hopefully watching this with good social distancing practice from Arizona, and all of our friends and family members. We love you very much, and we're grateful that you're taking these words and these recommendations from medical professionals and experts to heart. This is a critically important part of this if we're going to put these measures out there, that people actually take them seriously and abide by those social distancing guidelines from CDC, from our state and our counties and our cities. We'll get through this together. I have no doubt that we'll get through this together. And I am so incredibly honored each and every day to have just a wonderful team to try to help our community out as well. If you have any specific challenges or problems, things that you think we can be helpful with, don't hesitate to reach out to us. You can use that email that I mentioned, townhallquestions@mikelevin.org. You can also visit our website, mikelevin.org, and submit a comment there as well. I want to thank Dr. Garfield for being here. Hopefully he'll do this again. And I know I'm going to be doing this once a week for as long as this crisis lasts. So hopefully you'll tune in. There'll be a lot of information every single week. We're truly grateful to this community. Stay safe out there, follow the guidelines, and we'll see you again next Saturday.